I'm Dr. Tim Culbert, a developmental pediatrician and co-founder of Natural Mental Health, the organization that created this event. And before I turn things over to our lovely and talented host for today's session, Mr. Andrew Heaton, I just wanted to make a few remarks to frame today's discussion. I wanted to share with you all this quote from researcher Dr. Nathan Fox about the negative impact that COVID-19 is having on our children and our teens. He had this to say, and I'm paraphrasing: "We are creating a generation who will cost us more in terms of the healthcare system and the judicial system and the educational system in future years than it would have cost to provide them with adequate support right now in this moment." And I thought that was a very impactful quote. And, as you may know, we are all struggling. During the coronavirus pandemic, as an example, rates of depression and anxiety amongst kids and teens and adults worldwide have increased dramatically. And perhaps more importantly, our children are living through an explosion of what are called adverse childhood experiences, or ACEs for short. These ACEs include things like physical or emotional abuse and neglect, and even household dysfunctions in their many forms. It's important to understand and address this issue right now, because the more ACEs a child has in early life, the more they are at risk in the future for developing both physical and mental illnesses. So we really need to act right now. And the coronavirus has intensified the experience of ACEs in our children across the globe. This afternoon, we do have some very good news to share with you all. There is an antidote to these adverse childhood experiences that I mentioned, or so-called ACEs. And the antidote to ACEs is to provide what we are calling resilient childhood experiences, and hence the name of our lecture series and workshop series that is upcoming, called the Natural Mental Health Resilient Kids Summit. And so we're here to talk about this afternoon these resilience building skills, lifestyle behaviors, mind-body techniques, and other holistic strategies with you in a very introductory form for the next 30 minutes or so. And then if you like what you hear, stay tuned for some more information at the end of the session about a series of more comprehensive training workshops that are coming up this winter, which I'll tell you about a bit later. So now let me turn things over to this afternoon's real host, Mr. Andrew Heaton.
Hello, everybody, and thank you very much. Thank you very much, Tim. I'm not a psychiatrist, just so everybody knows. I'm a comedian, but I exclusively date psychiatrists, so I feel like I have some skin in the game on this. And we'll be talking to some people that are good at helping children, and we'll hopefully be able to give us all tools to help our families momentarily. But before we get into that discussion, I want to hear a little bit more about natural mental health and about resilience. And so I'm going to introduce Henry Emmons. Henry Emmons is a consulting psychiatrist, co-founder of Natural Mental Health alongside Tim, and an author. Welcome very much, Henry.
Thanks, Andrew. I should probably let you know I am taken. I am committed in a committed relationship.
In COVID, I'll take whatever I can get. So afterwards, we'll discuss.
So on behalf of the whole team at Natural Mental Health, I just want to welcome you all here. There's not any question in my mind that we are experiencing unprecedented challenges right now. But the truth is that life is always stressful. We can't avoid stress, and we can't protect our kids from it completely, nor should we. Stress is not a bad thing in and of itself. It forces us to respond. It challenges us to see, to think, and to act differently. The poet Rilke wrote, "Winning doesn't tempt that man. This is how he grows, by being defeated decisively by constantly greater foes." Tim and I started Natural Mental Health for times like these. Tim is a little older than me, but we have both been practicing medicine holistically for over 30 years. We have long seen that the usual ways of working with mental health problems, while good and helpful, could use a little improvement. Natural mental health is built on the belief that the body will correct itself if it's given the right conditions. The mind will find peace if we learn to allow for it. And joy is accessible to anyone, no matter their genetics, their past history, or their current conditions. We are all about what we can do, what positive steps we can take to restore the natural state of good mental health to which we are all born. That means, among other things, a focus more on skills and less on pills. One of the most important of these skills is resilience. I think resilience is evident everywhere. It's in nature. We hope that it's in our democracy. And if you look for it, you will see it in our children. Resilience is the ability to see clearly the challenges before us, to be able to face them directly, and to be able to get back up each time you've been knocked down. Resilience is a skill, one that every child desperately needs right now. And remember, skills can be built. There are many ways to grow resilience. Today's session and this entire workshop series is dedicated to doing just that. Andrew, I'm going to turn it back over to you, and looking forward to all of the great comments this afternoon.
Thank you very much, Henry, and wonderful to learn that, and a very optimistic take on things, which I enjoy very much. I'm glad to find out that we can all have that ability to find joy at whatever stage we're in. And we will hopefully do that in part by talking to some of our experts today. We are joined by Omkar Sawardekar. He's an independent consultant working with diversity, inclusion, and mental health with experience as a therapist, and Anastasia Ristau, who's a PhD-level licensed clinical psychologist and director of psychotherapeutics for Prairie Care. Welcome to both of you. Hello.
Hello, thank you.
Hi, yes, thank you for having us.
Sure. And Omkar, I want to kick it to you. As I said, I've dated psychiatrists, but I don't have a degree in this. I do own a couple of lab coats for prop purposes, but I don't, when people say mental health, what are they talking about exactly? What does that mean?
Yeah, and even before we jump into that, I think we should introduce ourselves
Right.
a little bit, share a little bit about ourselves. My name's Omkar. I use he, him pronouns. It's really fantastic to be here. I'm really excited to be part of this community. I want to share a little bit about how I orient to this work. Professionally, I'm very interested and committed to engaging mental health through this holistic lens. For me, what that means is looking at identity, race, gender, sexuality, looking at culture, and looking at trauma, and how do we practice in a way that integrates all of these, and how do we do that not only in an individual sense, right? When I'm a therapist, how do I work with individuals, but how do we approach that in the context of organizations, systems, policy? It starts to get really complicated and layered, but that's kind of the frame through which I approach this work. And so I'm really excited to be here, and I'll turn it over to Anastasia.
Thanks, Omkar. So I'm a licensed psychologist. I've been doing this work for 16 plus years, many of those years in some way, fashion, or form with Tim Culbert and his crew. And I am very passionate about finding creative ways to help kids and teenagers and their families and all of the different adults that are involved in their lives learn about the different ways to tap into our natural abilities to rise above what also are the natural challenges that we face as we move through life. So that work has become flavored a bit over the last many years as I have become a partner in marriage, and then a parent myself of 2 kids who are 9 and 11 right now, as well as parents to some adopted animals and with trauma history of their own. And you know, that is such a humbling part of my life that I find infuses naturally into the work that I do in terms of keeping it real and helping me remember how hard some of this can be. I'm really excited to bring forward in as many ways as we can through this forum all of the information and expertise that all of us here have developed over the many years of our doing this clinical work, as well as the personal experiences that we've had. You know, that part of my passion truly also is empowering all of those around us to learn these same skills and this information and build their own resiliency. So I'm very excited about this opportunity to talk a little bit about some of that today.
That's wonderful. And I get the distinct impression that both of you really care about people and want to help them and want to give the folks watching the ability to make sure that their kids are in a healthy spot and coping with the stuff that life is throwing at us right now. So I'm very glad you're here and very keen to talk to you. And so I will kick that off by saying, Omkar, can you just kind of broadly define mental health for us and in terms of what we're dealing with and how this interacts with kids?
Yeah, and in some ways, you know, I could give a kind of a definition, so to speak, but I'm interested in kind of making this a very accessible topic, you know, for us to engage with, right? And so I want to draw the parallel to physical health, right? If you ask a random person or a group of people, so what does one need to do to be healthy physically, right? You wouldn't get a response. You generally wouldn't get a response that's, hey, I have no idea. I have absolutely no idea. I'm not a doctor, right? And so when we think of mental health, you might get something like that more often. And so with physical health, people might say, hey, you need to drink more water, you know, you need to exercise, eat your vegetables, stretch. There might be a kind of a consistent theme you might hear. And so I'm interested in, like, what does that look like for mental health, right? If we started to think about collectively for ourselves, like, what does that look like? Is it about emotions? Is it about healthy relationships? Is it mindfulness, self-awareness? And so that's kind of, rather than giving a clean answer to that, I want to propose that question in response, right? That's one thing to hold. The second thing that really comes to mind is a very powerful framework that I found that I encourage people to look into is this concept of window of tolerance, right? And if we think about what is our range of tolerance in terms of between being in a flow state when we're able to be present and engaged and connected with what's happening, or moving into either anxiety at the upper end or depression at the lower end. And this is a fairly universal concept, right? That we can start to attune to, and then we can connect to events and circumstances that push us into a state of either being stuck on, right? A more of a action-oriented, either fight or flight, or stuck on off, right? In a state of freeze. And so, so that's a tool that I found really helpful in navigating mental health that is fairly universal, that a lot of more complex mental health ideas and complex concepts map onto. So
That's fascinating. And I think that comports very well with what Henry was saying earlier, that stress isn't inherently bad. I like the way you framed that, Omkar, of too little stress, you start to get depressed, too little input, whatever you want to call it, too much, you're actually going to become anxiety ridden. And so it's not that you want to avoid this so much as just have the healthy balance and a framework that works for you. Wonderful tools. Thank you very much. To explore more tools that we have, I want to kick it to you, Anastasia. I don't have kids, but I give as much parenting advice as I can to people with children, because I assume that they want that from people without kids, and they want a fresh perspective, and they all love it, right? And I think that that's going on with a lot of stuff right now in mental health, where everybody's kind of comparing notes on what they're doing to raise their kid. Everybody's trying to figure out what the best thing to do is. So there's lots and lots of information coming at us. So just from your perspective, what are some of the things that we can do to strengthen our family and keep everybody in a good mental health state and help people get a little past all that noise?
Yeah, I mean, it's so interesting as I think back pre-COVID, pre-pandemic, there was a lot of discussion from a lot of families about social media and about video games and about devices. And the focus was a little less on the bigger picture mental health and a little more on like, oh, how do I get my kids off these devices? So I have to actually say one thing I'm thankful for with these last 10 months is I feel like the door that was starting to open a little bit to us recognizing and acknowledging the role that mental health plays with our kids and families has swung open so much wider right now. So we're in such a great time of opportunity. But then what happens is, like with COVID, when people say, what can I do to protect my family? That's a little more concrete, right? Like, okay, we'll put up some plastic physical barriers when you're at the store, you wear your mask, you're gonna wash your hands for 20 seconds, and here's a song. But how do we do this for mental health, which is, so much less concrete and so individual? Every person is different, every family is different. But what I can tell you is, at the core, there are a few things that I think we can all tune into in terms of ourselves and our own mental health, as well as how to support the mental health and strengthen and booster the mental health of our kids and our families. So one piece of that is when all of the rest of the world and life feels like it's chaotic and unpredictable and a mess, we got to figure out where we can zone in on pieces that we can be in control of and get those day-to-day basics to be stable and consistent as much as possible. I think we have to be careful though not to put too big of expectations on ourselves to like do all things. I see that a lot in our culture of like, okay, I'm going to do everything. I'm going to make every family meal consistent. We're going to have bedtime the same every single day. We're going to get up at exactly the same time. I'm going to exercise an hour every day, and I'm going to eat only healthy things. And then we set ourselves up for more stress and more shame and more frustration. But finding one place to start for your family, finding that one area to just start making that stable and consistent that your kids can rely on, that you can rely on, that's going to offer a lot of stability and strength for your mental health. The second piece oh, sorry, were you going to say something?
I was just saying that was a very good point. Please continue.
Oh, good. The second piece I would say is that we also, as parents and other caregivers as well, we do need to pause for a moment and learn to really trust that we know these kids and these kids know themselves and they know us. And we need to trust that our kids are going to naturally tell us and show us what it is that they need. They may not do that with their words, right? So they're not going to use an adult brain way of managing all of this. But if we pay attention, they're telling us a story. They're telling us what they need. For younger kids, it might be through their play or through their behaviors. You might see more meltdowns. You might see more crying episodes. You might see difficulty sleeping. You might see changes in eating patterns. You might see more aggressive play, things like that. For teenagers, it's a bit more challenging. They're going to tell us a little more through their nonverbals. They already by nature tend to isolate more. Perhaps they isolate even more than usual, or they get super zoned in on their electronics, or their behaviors start to get out of control. Listen for the meaning between what you're seeing and what you're hearing. If we can find that meaning and trust that they're telling us what they need, and then pause for just a moment to tune into that and let them drive that conversation, there's a lot of benefit that can happen for their mental health if we can do that. So part of that too is when you're having, let's say you're noticing something is off, or you're noticing there's some changes with their behavior or how they're playing. it's not a bad idea to sit down for a little bit and start talking about it, but also using that time to name what you think they might be feeling, to validate and honor those emotions. When we just describe and label our feelings, even what we're feeling, that's incredibly valuable for their mental health, but it also helps for them to learn what their own feelings and emotions are. So that's kind of a third thing, is having the conversations and naming and validating what the emotions are, especially during times like this. It's okay to not be okay. And it's okay to be okay when things are not okay. Like, it is okay to have happy, laughing, silly filled moments when the Senate Capitol is being stormed, or when there's all kinds of storms happening all around us. Each kiddo has a right to what they're feeling. Each adult has a right to what they're feeling, and all of those feelings are important. Another piece I would add in is pausing to take some time out of your own busyness as a parent to join into your kids' world. And what do I mean by that? We all have so much going on, even during these pandemic times when there's less scheduled. So we're in our houses more, we're around each other more. But even within that, I'm finding that there's just this constant busyness, and there's constantly things to do, lists of the to-do lists and whatnot. Our kids and our teenagers actually are craving our time. They're craving our attention. So pausing our own stuff for a minute to even sit down and watch the YouTubes with them, as annoying as those YouTubes may be, because nobody likes more than watching YouTubes about squishies getting reconfigured into other things, or Minecraft games about like stuff that I can't even understand. So I should stop talking now. But pausing and joining it, asking questions, describing what you're seeing. If it's a teenager, it's going to annoy the heck out of them. But let me tell you, what they say on the outside is often different from what they're feeling on the inside. It's incredibly valuable for them to know that you care about what's happening in their world enough to join them for even 5 or 10 minutes to describe it, to be present with them in that moment. Setting aside those purposeful times to reconnect are really important. And it's also important to do that as a family. So that's another kind of final piece that I would suggest during these times. Even if that means just once a week for an hour, you have a family night where you play a game together. Or if that for your family or your household means you don't have an hour, but you have 15 minutes Monday, Wednesday, and Friday to just do something interesting together, or to talk and have a conversation, or have a snack together. Whatever that might be, there isn't really a right or wrong to it, but that purposeful, intentional, fun, kind of interesting reconnect is really critical to our mental health. Omkar, would you add anything to any of that?
No, thank you. I mean, you really laid it out so well. The couple of thoughts that come up that I took some notes on is, from a mental health standpoint, one of the ways I think of navigating how well we navigate tension and conflict is a measure of health in some ways. And this constant tension of schedule and being in flow, right? Tension between our own needs and supporting the needs of others, right? Life is full of these tensions. And so parents, families, and any of us are constantly navigating these tensions. And not feeling that we have to get it all figured out, but finding ways to be at peace in the midst of those complexities and tensions is something that we can kind of rest in collectively. And that's a powerful thing.
Something I'm struck by hearing both of you speak and describe all of the kind of plate spinning that parents are doing right now to try and ensure that their kids are in a good state. Um, I wonder if you could speak to any feelings of guilt or inadequacy that parents might be having regarding all of the things they're doing for their kids. I know that a lot of my friends like confide in me that they feel really bad that they're letting their kid watch more TV than they used to, where they're having a glass of wine on Wednesday when they only used to do it on Friday or something like that. Like, how do you think parents should be responding to themselves in this environment? Anastasia?
Yeah, I mean, guilt and shame, I think, starts from the minute you find out you're going to be a parent in normal times before the pandemic.
Oh, shoot. Good to know. Thank you.
Right? I mean, it's almost instantaneous, and it's unfortunate in that sense, but it's there for a purpose, right? It helps to motivate our systems to really gear up and get ready. But, you know,
And let me just real quick jump in while you kind of brought up guilt and shame, and something I found really powerful is this working definition of guilt versus shame. And shame as this concept of I am bad, like I'm inherently bad. I am bad, I am wrong. Guilt being I did something bad or did something wrong, right? And guilt can be a motivator for change and useful in making change happen, but shame doesn't, right? There's no healthy outcomes that come from shame. So we can't sustainably shame ourselves or others into being better people. Thank you.
yeah,
Okay.
no, that's spot on. And thank you for that. Because here's the thing, what we're all doing now is we're looking at social media, or we're listening to other people talk, or we're seeing things on TV or Netflix or whatever, and we're making these we're drawing these conclusions from these little snippets that we're seeing, that everybody else is doing this better than I am. And it's for a lot of us turning into that narrative of shame, of like, I am failing. I suck at this. I'm failing for my family. I'm ruining this for my kids. Or it's triggering a lot of anxiety about, what if I don't set this up for the best it can be for my kids and it's irreparable? What if what we're going through right now changes their life pathway and I feel responsible for that? And here's the thing, I hope this does change all of our life pathways. There are many beautiful things about hard, incredibly challenging times. And shaming ourselves or other people serves us no purpose. There is no right or wrong here. This is an unprecedented situation that we are, and none of us alive right now as parents have been through anything quite like this before. So guess what? Nobody has the exact right answer. So why are we beating ourselves up about that? That said, when we feel some of that guilt, that's okay to let that motivate us to take a look at the pieces where we can start tuning in a little bit and tuning up a little bit. And that's where something like what Natural Mental Health and the Resilient Kids Summit is going to do, is help you figure out, what are the nuggets within this that I can grab from that feel doable for me right now in the situation that we're in, that can help us move forward on a path. But also know that if one thing looks like a nugget to you, but is nowhere near interesting or palatable or even doable for somebody else, that's okay. There's not an exact right or wrong here. So stewing and brewing and all of the worry and the shame and all of the muck that can come with being a parent in general, let alone during this time, stewing in that isn't going to be helpful for us. We can move away from perfectionism. We can move away from that all or nothing mindset and know instead that we can give ourselves grace just as much as we can give other people grace, to just move one foot in front of the other. We'll get there. We'll get where we need to be.
And the other thing I'll say is it's completely normal to be comparing ourselves to each other all the time, right? Am I good enough? Am I this enough, that enough? Am I, this, and then the anxiety that can go with that. And it's important to kind of, to whatever degree we can drop underneath the anxiety, right? Is there some sadness here? Is there some loss? Is there some despair that, because there is a lot of painful stuff happening in our world, right? And being a parent and the grief and the lack of control that parents have a lot of times, and so sometimes the anxiety and worry can be covering up some deeper, more kind of authentic emotions that need attention, whether that's sadness or loneliness or inadequacy. And so whatever ways that people can access those emotions in sustainable, healthy, collaborative ways will support kind of dropping underneath the comparison and the anxiety.
You're both making me feel much better about myself. Thank you. And I don't even have kids, but I feel better. And
Hey,
Anastasia, I'm in agreement with you. I think good things can come out of this. I had a moment, early down in lockdown where I was talking to one of my friends over the phone, and I called him and I went, I feel so lazy. I've not done anything today because I was having difficulty motivating myself. And he went, what have you done? And I went, oh, I talked to my dad on the phone for an hour. I called some of my friends in Scotland. I did a Zoom with my high school teacher, Mr. Lemin. And my friend goes, it sounds like you spent your day just talking to people you love. And I was like, oh yeah, that sounds like a nice thing. That doesn't sound like that. But I'll digress from that. One of the things that I'm curious about is everybody's alluded to the concept of children being able to respond to the current scenario that's being thrown at them, and being able to cope with it and move on from it. And so there's an element of resilience that we keep talking about and alluding to. So what are some of the things that you can do to foster resilience in your kids as these things are happening?
Yeah, great question. I mean, here's the thing. Kids and teenagers are incredible observers. They are so aware, and sometimes they're more aware than they even realize, meaning they're really in tune with our emotions. The adults around them, they may not necessarily be able to label them properly or point them out, but we're impacting each other. The problem is with kids and teenagers is while they're fantastic observers, they're terrible interpreters of those emotions. So they may feel something is happening and then draw their own conclusion from that, which chips away at that ability to be resilient, to rise above, and to kind of come back around and learn and grow from the tough situations. So one of the better things that as adults we can do to really foster that resiliency for kids and teenagers is to do our best to feel the emotions that we feel, to honor them, and to show them and express them in a healthy way, but moving through them completely in a way that has a beginning, a middle, and an end. So often kids really only see us when we're kind of in the heat of it, like not necessarily handling it the best way, but for some reason we don't show them, we maybe hide from them the resolution of that, and they're not in our heads, so they're not able to hear and see what's happening leading up to what happened here. So if we can just start putting on the outside what we're thinking and feeling on the inside in a way that's just kind of allows them to begin interpreting in a way that's a little bit healthier, and then for them to see that we can move through emotions, really great ones as well as really hard ones, and that life goes on, that we can get through it and in fact come out a little bit better in the end, or that we can do this together. And when we come through especially hard emotions and then things calm down, we're able to wrap it up with a bow essentially to set them up for understanding, okay, the next time I come across this kind of situation, I can handle this too. I can get through this. And oh yeah, that one time that mom was really freaking out about whatever it was that was happening, she paused and she said, okay, I'm really freaked out about this. Hang on. I'm going to take a second and I'm going to breathe, and I'm going to remind myself that this too will pass. It will be okay. I'm going to get through this. We're going to be all right, one step at a time. Here we go. And then we move through it. So they see that, then they might repeat it. They're going to do that.
Great. Well, I've got one final question for you, and then we'll be able to wrap up, and we'll give everybody the details about these forthcoming workshops that are going to happen. Question is this. Last week, my nephew asked me when this is all going to stop and life's going to go back to normal. My instinct was to lie to him and tell him exactly 7 months, but then I felt bad about lying, so I just avoided the subject. If somebody's asking their parent when life goes back to normal, what should you tell them?
Actually, let me jump in. This is partly because of what you said. It was so relevant because this is a pattern that happens, right? Because kids are curious, right? We're all curious, like they're inherently curious and they want to know, like, hey, when is this going to be over? It's a natural question. Many of us are probably wondering the same thing.
Yeah.
And so we're given this question that we may not know the answer to. And then subsequently we might feel, anxious or overwhelmed or whatever happens, right? And then we want to protect, right? I want to protect this kid from the difficult truth. And so we might want to give them some, pat answer, right? Either we go in that direction, like you said, I want to joke about it, or I don't know what to do, so I want to avoid it. So I'll just kind of avoid the subject. And so neither of those are going to be healthy, right? And so how do we engage in this case sometimes with the unknown, or create a space for kids to navigate their own discovery, right? Like, oh, if it's over in 2 months, what does that mean for you? If it's over in a year, what does that mean for you? And how do we support them in navigating their own truth, right? That's kind of the philosophical piece. And I'll say some more things in a minute, but I'll turn it over to Anastasia as well.
Well, and along that line, here's a little trick of the trade. When kids ask questions that are hard and we're not quite sure what the answer would be, so in this case, when is life going to get back to normal? When are things going to be normal again? This is your golden opportunity to get a little window into what they're thinking and what they're feeling and what they're experiencing. So the little trick of the trade is, rather than moving into adult mode of, I have to know the answers and I better find the right answers so that I can help them feel better or whatever, we can give ourselves permission to actually be curious instead and say, well, what does normal even mean to you? What do you think that would mean? What would life be like if it got back to normal? And maybe what they were actually talking about was they missed going to a restaurant. Maybe they weren't talking about life in general, is what you think. There's like, I miss going out for pizza or whatever. But you can hear what they have to say and learn a lot and then join with them in that. And it becomes a whole different, beautiful discussion. Or this is a great time to even just like take a moment to reflect the question back to them. Like, I don't know, what do you think? When is life going to get back to normal? And they might have a beautiful answer that actually offers you some piece of joy as well in a time that we don't always know what to say. But, I would just add to that too, that ultimately we don't know that life can get back to normal. And do we really want it to get back to what the normal was before? I hope that some things will change from how they are right now, but I hope that we will retain some of the pieces of what we've learned and what we've gone through during this time that we're in, so that our next normal will be stronger and more resilient and a little bit more connected with each other.
Wonderful. Let's hope for that. Yeah.
The last thing I'll say is this is so much about grief, and if you know me, I talk a lot about grief. And so, and grief is this concept of, in an accessible way, I like to think of it as the space between what is real and what we want or what we wish for. And through that lens, we're always navigating grief. We're not getting our needs met, or, someone did something that didn't work for us, or the external circumstances don't match what we wish for in the moment. And so it's an opportunity to engage some of those. And culturally, in the dominant culture, we don't necessarily do a great job, right? It's always about, the new and the exciting and the weekend and it's sunny, but we don't engage the, oh, it's dark and sad and I'm lonely. And it doesn't mean we have to go around telling everybody about our grief, but we can start to integrate it a little bit more into what we do. And this is an opening to do that.
Well, I think you've both had fascinating and very helpful answers to all of these queries, and very much appreciate it. For people that want to keep learning this kind of thing and having more tools in their toolkit to make their children resilient, it would make sense to attend the forthcoming workshops. And so for that reason, I'm going to say goodbye to Omkar and Anastasia. It was very nice talking to you, and kick it back to Tim, who's going to walk us through what we need to do to get to these workshops.
Well, thank you so much again, Omkar and Henry and Anastasia. That was really great information. So if you did find that information to be helpful and of interest, we can give you a lot more of that same information on really building resilient skills for the whole family. So we have 3 upcoming workshops. in February and March and April of 2021, again, funded by a generous grant from the Minneapolis Foundation. And what is exciting about that is that we have been able to keep the price quite low. So for $25, you can attend a full day workshop. And the 3 workshops that we have lined up are as follows. The first one talks about natural approaches to support anxiety in kids and teens. That is February 5th, 2021 from 9 a.m. to 3:30 p.m. And then there is a Q&A session, questions and answers with faculty about 2 weeks later on February 18th in the evening at 6:30 p.m. The second discussion or workshop is on March 12th, and that's on natural approaches to depression. And again, 9 a.m. to 3:30 p.m., followed by a question and answer session March 25th, again, beginning at 6:30 p.m. And then the final workshop is Natural Approaches to ADHD on April 16th, 2021, 9 a.m. to 3:30 p.m. once again, and then a Q&A session April 29th, beginning at 6:30 p.m. So we are able to charge just $25 per workshop. And if people feel that that is something that they can't do at that level, we also have some scholarships available. If you are interested in registering for these, you can go to naturalmentalhealth.com, our website, and you'll see some information on how to register for the conference.
Great. Wonderful. Well, it's been a pleasure to be here with all of you. I've very much enjoyed talking to you. I have, in fact, learned quite a lot that I can apply to my own life and to when I eventually have children. And Tim, I am excited enough about your workshops that I am going to try to adopt multiple children between now and then so that I can participate in them.
We'd be happy to have you.
You just need one.
Oh, good. Well, perfect. Whew. Well, that okay. I figured it was 1 kid per workshop. That makes my life a lot easier. Thank you very much, Omkar. Thank you so much. And thank you everybody for watching, and everybody stay happy and healthy.